Hey, good afternoon, everyone. Thanks for joining me on Facebook Live. I'm Dr. Bill Bird. I'm the Chief Medical Officer at CGH Medical Center in Sterling, Illinois. Glad you could join us. And I am really interested in talking to the guest that we're going to have with us today. Uh, Her name is Vanessa Simonton, and Vanessa is the manager of our OB floor here at the hospital. And I'm going to pull Vanessa in a few minutes here. But because we did this another field trip of her floor and did that this morning, and we're going to show that to you when she and I have finished our conversation. I thought it would probably flow better today if I started out with some COVID related information, and then we'll transition into our OB discussion. So as always, as I'm chatting, feel free to send your questions or comments. Be glad to entertain those as we go forward. I guess that's the whole idea of doing this live. So let me start on the COVID front with just talking about some results here at the hospital. So today our numbers are, we've done here at the hospital 16,446 tests for COVID for patients. That's between ready care, emergency department, and those kind of places. 2,873 of those have been positive. And I was just thinking to myself today, gosh, it was probably April. I remember we went from 3 positives to 9 in one day, in terms of our total number of positives here at the hospital. And I was like, oh my gosh. Obviously, I didn't have a concept of what it was going to look like now, because if we went up 6 positives in one day, I would be ecstatic here at the hospital. We are not there right now. So 2,873 just at the hospital. We've had 13,484 negative tests. And probably the most sobering number here in Whiteside County, we've had 129 deaths. That's 1 in 426 citizens in Whiteside County have passed away related to COVID. Also of note, I just looked yesterday, and actually I looked today, and Whiteside County's official total count as of today is 4,981 positive cases. Now, granted, there have been obviously folks who had symptoms who didn't go to the health department or didn't go to the ready care or the hospital to be tested. So we know that we've had significantly more than that. But even at 4,981, that's 1 in 11 people in our county that have had COVID. Oh, thanks, Matt. And you can our confirmed case count, even from when I looked it up this morning on the state site, has gone up to 5,100. So yeah, that's a lot of folks, and I feel pretty comfortable that you probably could double that in terms of the folks that have been asymptomatic and didn't realize it, or people that had symptoms and chose, for whatever reason, not go to be tested. So you're talking, 20% roundabout. That's not good. And of those 20%, obviously 129 of our fellow, at least just in Whiteside County, and we service an area bigger than Whiteside County even, have passed away from COVID. So, yeah, let's talk vaccine a little bit. We had a couple questions that came in even before we started, before I came on here, about the vaccine, particularly for those of you in the general public who are older or know someone who's older, about, okay, so when is the time that those in the general public will be able to start receiving this vaccine? And first of all, we still don't have a complete picture of what whole process is going to look like. I did hear today that the governor has said that and we're getting close to what's called 1B, which was they've done all the healthcare and nursing home folks, and then it's time to start doing some of the general public, and in particular folks who are older. And it sounds like our state's going to do folks over the age of 65 would be, I think, the next group. That's what I'm hearing. In terms, though, of how that's going to get rolled out, when that's going to get rolled out, that is still information that I don't have access to, nor does anyone here at the hospital at this moment. I suspect one of these. Um, yeah, so I'm probably hi Jan. So I'm probably in category 1C for the vaccine. Where should we be getting our vaccine? Our provider, the health department. So I don't know yet. I don't know how that's going to be structured for anyone beyond the hospital and nursing home setting. Nursing homes, pharmacies are going into the nursing homes. I was talking to the nursing home that I go to see patients in today, and their first shot is on Monday. Other places I hear this week have started to get some vaccines. But in terms of how that's going to be rolled out as the health department versus the hospital versus pharmacies, giving people who are 1B, 1C their vaccinations, I just don't know yet. I suspect, though, in just guessing, in one of my next couple updates here, next couple weeks, we'll have some more detailed information, as will you. Maybe even before I do we do our Facebook Live. So right now, here's some data that I do know. So the vaccine, as of when I looked this morning, has been given to 5.3 million Americans. That is not enough. That is obviously we're still trying to get up to speed on getting these distributed because there's more vaccine available than have been given right now. Of those 5.3 million people that have received the vaccine, there have been 29 severe reactions. That is 100. That is 1 in 182,758 people have a severe reaction. I'm going to read that number to you again. 1 in 182,758 people have had a severe reaction of the 5.3 million Americans who've received this so far. From what I read, the number of Americans who have died from receiving the vaccine or have not been able to recover from the reactions to the vaccine has been zero. I'm going to repeat that again. Zero. And so this vaccine appears to be safe. The more people that have received it and the more folks who have not had severe reactions and particularly have not passed away from the vaccine, the more and more and more folks like myself feel very comfortable in saying this. So I just wanted to be clear about that. Um, I think that there's, you're hearing about a new variant of COVID that is beginning to make its way throughout the world. And we've had some cases here in our country. We will have more. And that makes it even more important for this vaccine, for the percentage of us who are willing to get the vaccine to have that occur. And by the way, you can see I got my second vaccine today, doing well, feeling good. Um, so with this new variant, it just means that it doesn't sound like it's, as far as I can read, more dangerous, but it does mean more of us will probably have a chance of getting it, which means that it's even more important to get a higher percentage of folks to get the vaccine so we can have more herd immunity. I've been thinking about this vaccine situation, and obviously we still need to ramp up the whole process so they're available to many of you out there. And I so much want as many as possible to get this as quickly as possible. It just strikes me that some of the greatest strengths of our country, such as we really value the individual and the individual's ability to make their own choices and chart their own path. We also really value each of us having free access to information in our country, which, from my perspective, is one of our country's greatest strengths. But sometimes your greatest strength is also one of your greatest weaknesses. And so, I think, in terms of this vaccine, from an individual standpoint, I get it. Having to decide, do I think this is safe? Do I think this is worth receiving for me? Yes, that's something that needs to be thought about. And I also see this more and more as an opportunity for us to, when it becomes available to get it, to perform a civic duty to help our community, and to help our nation, so that we can get restaurants and hotels and bars and people that want to have big weddings and people that want to have family gatherings and our elderly who want to be visited in their nursing facilities and or in their homes to be able to get back to life as usual sooner rather than later. So yeah, more and more I'm seeing this as a yeah, it's about us as individuals, but it's also bigger than us. And it's not just about me right now. It's about those around me. And so I encourage folks to think about that as you think about it for yourself and as you talk to others around you about this vaccine. And the other thought that just crossed my mind about the vaccine and some of the resistance to it is social media is great. Heck, I mean, Facebook Live, we're using the social media to get some information out to you that would have been very bulky to try to do in the past. It's great, and it isn't so great. In some ways, social media is like a newspaper on steroids because there's always been newspapers and with differing viewpoints and differing perspectives on a similar situation. So it's not like we've been homogenous in terms of how we look at issues in our country. Social media has taken that to a new level. I don't mean to be too much on a soapbox, but I would just encourage folks as they go about social media to be kind, to be compassionate. Um, what I say, what I'm saying now, what I'm typing now, if I were in front of someone face to face. I also think it's important more and more to be really, to speak the truth. And I'm trying to do that here with this vaccine conversation, monologue, I guess you will, if that I'm having with those of you who are listening at some higher level, not at my level, but at a um, perhaps governmental or other level. I think there need to be some conversations about, is social media a right or a privilege, and particularly for those who are in positions of authority uh, to say things that are not true, and for others who are quite aware that that's not true, to let that to continue to happen because some folks can't differentiate between that. So anyhow, enough about all those things that have been going through my mind. I appreciate you listening to those things, and I just encourage you to take those under consideration. So, COVID wise, otherwise, hospital, we are still having COVID patients. Um, had a little bit of a Christmas bump, but nothing like we were at in November. Here's a question. Thanks, Bonnie. Will our own physicians have a list of patients that we need to get on that are waiting for the vaccine? I don't know yet. I don't know yet, Bonnie. I'm not sure. And as soon as I have information, as soon as CGH has information, we will be getting that out to you. I did read something today that the people that are in charge of getting these vaccines distributed and given are they're moving towards a mantra. We don't want perfect to become the enemy of the good. So all these, okay, what about this? What about this? I think you're going to see a trend more and more towards this big bucket of people needs to get the vaccine. Period. Get it done. This big bucket of people need to get the vaccine. Get it done. And I think that makes sense. Um, you can get too into the weeds, and then we don't get anything done in terms of getting folks their needed vaccinations. Thanks for the question. I appreciate it. So as I go on here further, I'm going to be pulling Vanessa in here in just a moment. When Vanessa and I chat, feel free to send more questions you might have about COVID-related issues. Okay, Michelle, how long is a person contagious? Well, right now we're having folks isolate for 10 days after the onset of their symptoms, and assuming that they're feeling better. At the end of that period of time, they're fever free. They are able to go about their business. Of course, wearing masks and those type of things. It does appear, from what I'm reading, that the biggest bulk of the infectivity for a person is a little bit before and then about 7 days after getting symptoms with COVID. And then by 10 days, the viral load that we put out is really dropping significantly. Okay, hey, Vanessa, are you out there somewhere?
I'm here.
Oh, there she is. Hi, Vanessa.
Hi, Dr. Bird.
So, everyone, this is Vanessa Simonton. Am I saying your last name right?
Yep.
Okay. And Vanessa is the manager of our OB floor here at the hospital. And it tends to be, in general, a pretty happy place. And I thought I would bring a happy place to our Facebook Live conversation today and get Vanessa in on this conversation. So, welcome, Vanessa.
Thank you.
Uh, so, I want to start kind of transitioning into the OB floor, but also talk a little COVID along with that. So, can you tell me a little bit and tell our viewers what is the OB unit doing differently as a result of our current COVID pandemic issue?
Yeah, so it's kind of hard to even know where to start with that question. We've had so many changes since the spring, and things continue to change as we learn more about the virus and specifically how it's affecting pregnant moms, and their babies. But every change that we've made has been in an effort to help our patients become healthier, help our staff stay protected against the virus. Um, and because of the nature of our work, since we work so closely with these moms and babies, we did implement changes right away. We wore extra protective equipment before we knew whether a mom was what her COVID status was. So
Right.
whether we knew if she was negative or if we just didn't know at that time, we started wearing the extra protective equipment right away. And now all of our moms are tested once they're admitted to the OB floor. Minimally, we wear masks and goggles when we provide direct patient care. And then if a mom is COVID positive, we wear the full protective equipment like you would see the nurses wearing in like CCU or anywhere else where they're taking care of COVID patients.
Yeah. Yeah. You know,
Um,
and folks will see this after you and I are done. We did a little tour of the OB floor, but and then we'll show them a COVID room. But one of the things that I think folks will be interested to know that we keep the baby still with the moms, even if the mom is positive for COVID, and we kind of have the baby in a little isolate. You want to talk about that a little bit, Vanessa?
Sure. So we do, like Dr. Bird said, we have a designated room where our COVID positive moms go, and everything is in the room ready to go. We keep the isolette in there. Any extra equipment that we might need after delivery, like a warmer bed, resuscitation equipment, it's all kept there in the room to kind of help streamline our process so we're not going in and out of that patient's room so that we can continue to be good stewards of PPE. And so everything is right there. It's one of our regular labor and delivery rooms, but everything is ready to go right there for the
Yeah,
patient.
another thing we talked about, I don't want to go in a great deal because we'll talk about it during our video thing, but I thought it was really, I mean, you guys have thought every detail through because we were talking and you said, yeah, even for folks, obviously they're in their labor and delivery room. Some of them have C-sections. And so
Mhm.
what are we going to do when we have someone that we have to wheel down the hallway to go back to the C-section area to do that? And you have a plan in place and you've actually had to execute that plan
Yeah.
for patients. And so, yeah, I mean, as you were talking to me about this, you guys have done a really nice job of trying to knock off any contingency um, regarding those patients.
Yep, we spent some time drilling that, and thankfully we were able to do the drills before we actually had to do it in real life. So that
Yeah.
was nice.
Yeah. So what's the status? OB, everybody wants to go see the baby, right? Everybody wants to say congratulate the mom and the dad and all those kind of things. Where are we at with our visitor policy on the OB floor right now, Vanessa?
Right. It is very different right now, and it was almost eerie at first because we were used to having
Oh yeah.
toddlers and
Yeah.
siblings and grandparents. Those they're actually the loudest ones, the grandmas. They get so
Are they really? Okay, I wouldn't have thought that.
yeah.
All right.
And lots of
What do they
visitors,
say? What are the grandmas yelling about? What's going on?
all kinds of things. They're the best and the worst. No, I'm just kidding. We love our grandmas when they come to visit. They so we were just used to having lots of visitors in and out of our department. So now the current status is that a mom can choose one support person to stay with her throughout her hospitalization, but that person cannot change out because we want to limit the number of individuals coming in and out of the department.
Okay. All right. Yeah, that's pretty restrictive, and I'm sure that can be frustrating for folks. And yet, yeah, that's
But I mean, we're thankful that we're in a time where technology is at our fingertips, just like this. Parents are able to Zoom or FaceTime or send videos and pictures to their families. So that's been really nice. And we've even had some creative families who have taken their babies to their window and shown their babies off to their families in the parking lot.
there you go. Yeah, there
Yeah.
you go. Yeah, you have to be creative. Yeah.
Mhm.
Yeah, sounds good. I saw a question pop up on the screen, Matt. What was that again? People that are hospitalized, contagious. Okay, okay. It's mask, protect, and social distancing works. Then why not a visit? So yeah, thanks for the question, Michelle. So what we have done with our COVID folks is obviously we encourage a lot of the FaceTime and those kind of things because that's easy to do, and then you get to see your loved one. Um, I can't remember. I haven't asked for a little bit, but it seems like if we're getting towards end of life type of stuff, that we have some stuff that we try to do for that with our COVID patients, at least being able to look through a window. As far as doing a rapid test, I think that's a good idea. We don't have, first of all, we don't have enough rapid tests still to be able to be doing it in that fashion. It just we're still we're still conserving those. So good question. I wish that we were able to do some of the things that you're talking about. It's just not quite there yet to be able to do that. And part of it too, yeah. So anyhow, good question. That's my answer, and I wish it was a better one. Okay, let's see. My son had H1N1 vaccine as a child. 3 days later, developed Bell's palsy. Um, yeah, my answer is yes. I think this vaccine would be safe for him. However, one of the things that I do read on the vaccine that I've read about the vaccine is if you've had a severe reaction to like a flu vaccine, which an H1N1 was a form of the flu vaccine, that you might want to be, you may not be someone who's a good fit to go forward with the vaccine. And by the way, of the folks that reacted, had the severe reactions of the 5.3 million people, I think, gosh, at least 2/3 of them were folks who'd already had known severe reactions to flu vaccine type of stuff. So, okay, what tier are we on for the vaccines right now? I believe we're still on 1A, and then the next tier would be 1B. Vanessa, you're looking at me like, I hope you have that answer.
It's all you.
Yeah, I hear you. I hear you. Okay. Yeah, good questions. Thanks everybody for bringing those up. So the Bell's palsy question, I get your concern. Yeah, I don't have a for sure answer on that. I think that's going to be a little bit gray. in terms of your son going forward with the vaccine or not. I don't think there's going to be a black and white. He should do it or he shouldn't. I wish I once again I wish I had an answer as like yes or no. Okay, where are we at here on my questions I wanted to ask? Oh, how many deliveries we have in a year, Vanessa?
So on average, we do between 500 and 600 deliveries a year at CGH. Last year, we did 565 deliveries.
Okay, so I ask you that question to ask you the next question. And I remember talking about this when the pandemic started, and that was, okay, so you have all these folks that are kind of they're together more than they used to be, during this pandemic, particularly early on with all that 6 weeks or so when things just kind of shut down. And I remember joking with your team on the floor about, hey, I wonder if you're going to have a boom in business about 9 months from now. So that's one theory. The other theory is probably on a more serious note that when folks are under stress, whether that be financial or just the fear of a pandemic, that they tend to have fewer children. I'm just curious what your I guess what are we what's the trend we're seeing here at CGH, Vanessa?
Well, I think the answer is still to be determined, but if
Okay.
you were to ask us today, I think we would go with the togetherness theory because we are almost at capacity today. We have the babies.
Okay, there was a lot of togetherness around 9 months ago around this day.
Yes, I would go with the togetherness theory.
Okay. Got it.
I did look back at the data though. And for December, we had, I believe it was 7 more babies in December this year than last year.
Okay. All right. That's good to know.
Or in 2020, I shouldn't say this year.
Okay, Michelle. Hi, thanks, Michelle. I appreciate your feedback. Our OB nurses are great. I couldn't agree with you more. Thank you for those kind words. So how, obviously we're talking about when women show up and they're in labor and what you do. Can you talk a little, there's about 9 months of period of time when women aren't in labor, is my understanding of pregnancy. So can you kind of talk a little bit of how your team coordinates taking care of these patients who are, as they're kind of over in the clinic, seeing the OB doctors over there and getting information to you, so when they show up, everything flows well on the OB floor.
Mm-hmm. So I always brag about the hospital and how the hospital is connected to the OB clinic. So we're in very close proximity, which is awesome. You don't even have to go outside to get over here. So
Yep.
the information is easily passed between the two places. We work closely with 4 OBGYNs and in our nurse midwife. And it's actually been very beneficial because there have been times where they've had patients at the clinic who have needed emergent care and they were just steps away to get over here. And on the reverse side, when a patient needs escalation in care here at the hospital, we know that our physicians are just minutes away. So in that regard, it's really nice. From a nursing standpoint, we created an OB shared governance. It's been about 2 years ago now, where about every 4 to 6 weeks, nurses from the OB clinic and here at the hospital get together and we have like lunch together and we do a meeting and we talk about high risk patients. We go over any current or upcoming initiatives that might be happening, and we talk about COVID updates. And it's also just kind of helped to strengthen our relationship with one another.
Mm-hmm. Yeah, so that makes sense. So you're always just kind of fine tuning things and okay, what do we need to tweak here? And yeah, Yeah, you all do a really good job with that. So I just wanted to bring that up so folks understand that um, we are one big family in terms of how we take care of women and their pregnancies. So so to that end as well. So when someone shows up to the ED, just so folks who maybe are going to go through this at some point in time or they're just curious, how does that work? They show up to ED, either they're in labor or they have an OB related issue. What happens then?
So this question actually really kind of made me laugh a little bit when I was
I'm
looking
glad
over
I'm glad you found my questions humorous. That's good.
because I I ED nurses, I think they really appreciate what OB nurses do, and OB nurses definitely appreciate what ED nurses do. And although what's that? The care overlaps sometimes. I don't think any of us like willingly want to volunteer to do one another's job. But in all seriousness, we do work closely with the ED. They're a part of our initiatives that we do. We make sure that they know what to do in the event that a mom shows up and delivery is imminent and we know that that baby is going to be delivered in the emergency department. So what happens is if that seems to be what's going to be the case, the OB nurses do go down to the emergency department and assist with delivery and provide that immediate care to the baby right after delivery. Now, that doesn't happen very often
Right.
because if you've ever seen an ED nurse push a laboring mom in a wheelchair, nothing moves faster.
They make good time.
Yes, they do.
Okay. All right. Maybe we need to put a little governor on or something on the wheelchairs there to. Okay. No, I get it. I get it. Yeah. So
Yes.
basically, if someone has an OB related issue, most of the time they get whisked upstairs to your department and you all take care of them.
They're infrequently seen in the ED, even if they're not like in active labor. If they have a complaint related to their pregnancy, they are sent up to OB and we will do the assessment up here in our department.
Yeah. Good. So once someone has a baby up on your floor, how long are they staying on the floor before they're discharged these days? You hear about the days when someone would have a baby and they're going to hang out there, they're going to hang out on the OB floor for a week or whatever. How does that play out now, Vanessa?
Yeah, it's not like that at all anymore. A vaginal delivery, an uncomplicated vaginal delivery, generally stays between 24 and 48 hours, and an uncomplicated cesarean section is 48 to 72 hours.
Yeah, and that to me, even in my career, is the one that I find that has really compressed as the C-section folks. That to think about, they're turning around and they potentially are on their way out in, as you said, a couple days.
Yep. And that's the way. I mean, they prefer it that way. They want
Yes,
to get out and get home.
I get it. Yeah, yeah. And I, follow up to kind of that and the whole labor process. What would you say nowadays the percentage of women who are choosing to have epidurals when they go through labor is?
Yeah. So I don't have our actual data for our percentage, but I know nationwide it's between like 60 to 80%.
Okay.
But in the last, I would say maybe year and a half or so, we've actually seen a trend downward with more moms wanting to try to do things a little more natural.
Okay.
And what's really great about our department too is a laboring mom is one-on-one with her OB nurse. So we're able to provide them with that special attention to be able to help them cope through that labor process. We also implemented the use of nitrous oxide a couple years ago. So if they're wanting to use something maybe a little less invasive to help with the pain of labor, they can use that nitrous oxide
Is
to,
that laughing gas?
yeah.
I thought it was. I think of the Pink Panther when when I think of that. So you get people saying some interesting things when they're under the influence of nitrous oxide.
Yeah, yeah. We like to suggest that just to see what they'll say.
Some of how they really feel about the situation comes out when you're on nitrous
Yes,
oxide.
exactly. And then we also have a whirlpool room, which you'll see if you watch the tour of the unit. And a lot of moms like to take advantage of using that during labor and even after delivery too.
Okay.
And then the other, another training that several of our nurses have gone through in the last few years is the spinning baby training. And what that is it's a way to help moms manipulate their body during labor to help promote better fetal positioning and reduce the time that they're in labor and also helps to promote vaginal delivery.
Okay. Yeah. Good. A lot of good things going. I have one final question for you, Vanessa.
Okay.
And I tend to ask all the folks that we talk with this question because it's always interesting to me. So, what's your story? Why did you decide that you wanted to make nursing a career? And then why did you decide that OB was the best fit for you within the nursing world?
So I didn't always know that I wanted to be a nurse. I actually started out my college career at Western Illinois University with a major in biology.
Okay.
And because I knew I wanted to do something in healthcare, but I wasn't exactly sure what I wanted to do. And in my first semester there, I had a lecture where various healthcare professionals came in and spoke about their careers. And the one that stood out the most to me was the woman who talked about her nursing career. I just thought it was really interesting how she was able to serve in various roles and the flexibility that she had to kind of balance her work home life at the various points that she was at throughout her life.
Yeah.
Um, so when I chose to do nursing, I then eventually I transferred to St. Anthony College of Nursing, and I graduated from there in 2010 with my bachelor's in nursing, and started here at CGH later that year. And I started in the float pool, but I always knew that I wanted to get to OB. That was my calling when I decided to do nursing. And it only took me about a year. And so I came to OB in 2011. And I've served in several different roles within the department. I was a floor nurse. I've done lactation consulting. And then I was the OB educator and quality improvement coordinator for 2 years before I just recently accepted this position as the director of the OB department in December of 2020.
Yeah. Yeah, and I think our viewers are looking at you would probably say you probably haven't been a manager for decades.
No.
You're pretty young, but yeah, we're glad to have you, and I hear great things about the work you're doing, Vanessa. So I have a question here. It's not a question, maybe it's just a comment. OB is amazing. Shout out to Lisa V and Heather, my main nurses, for sticking with me and helping me through my hard time of 38 hours of labor. Oh my goodness. Help me through all of it. You guys are great. So, by the way, do you want to give any shout outs to your team there, Vanessa?
Oh, yeah, all of them. They are awesome. I mean, they make this job easy for me to transition into because they are just all so incredible.
Yeah, you have a really good team.
You know.
Michelle's asking, after COVID, will your hospital continue the sanitation protocol? I was in orthopedics the other day, and they gave me a card that said "need sanitized card to leave in my chair." I thought this was awesome. Will the whole hospital be able to get those cards? This would also be great for flu prevention. Boy, that's a good question, Michelle. I do think that we're going to have to take a long, hard look at how we've done things as COVID winds down at some point in time. and decide what things we want to keep and what things we don't need to keep doing. And I'm not sure to answer your question about the chairs in particular, but it will be part of our conversation as we begin to wind down. Right now, we just haven't. We've been so in the moment with COVID that we really haven't gone down that path a whole lot, other than be aware that we're going to have to start asking those questions eventually. I can't wait for eventually to happen, by the way. So, Vanessa, once again, great to have you. And for those folks who are watching, what we're going to do is a little walkthrough that we did through the OB floor today with Vanessa and Annette. Well, actually, she's doing what you did before you took on the manager job.
Mm-hmm.
And I encourage folks to watch this. Sometimes we have a little glitch when we get the whole thing going, but stay with us. It's about 15 minutes, and I think it would be interesting for you to watch. So once again, Vanessa, thank you. For all the viewers, thank you for listening. And I will be back next week to chat with you some more. Thank you. Hello. Hey, this is our OB floor walkthrough. Once again, I'm Dr. Bird. This is Annette. Hi, Annette.
Hello.
And this is Vanessa,
Hi.
who you just saw when we were talking on our interview. So here she is in person again. And we're going to take a walk through the OB floor and just kind of show you some things that might be interesting, I think, if you ever come up here and need to come up here about what's going on the floor. So with no further ado, the first place I'm going to take you is to a place that has changed quite a bit from when I started my career. We're going to go into the nursery. All right. So Liz, come on, follow me. So here's the nursery. And I think you might notice something about the nursery that instead of what you would see in movies or those type of things. What's not here right now?
Babies.
Oh, yeah. There aren't any babies in the nursery. What's up with that, Annette?
We like to keep them out there with moms and dads now.
Okay. All right. So I've heard this term baby friendly. Is that part of that whole initiative to have them out there?
It sure is.
Okay. All right. So Vanessa, when would a baby be in this room?
So we would bring a baby into the nursery if they needed a little extra TLC. So if they needed a little respiratory support,
Okay.
were born a little prematurely, then we would bring them in here to do further interventions and provide that support to them.
Okay, got it. So it's really select situations now. It's not like in the old days where this window they open up and you can look at all the babies and all that kind of stuff.
No, we leave the babies with their moms and dads.
Okay, all right. They get that being together right from the get-go, right?
Yep.
Okay.
Right.
And Liz, if you can wheel that over here. Vanessa, what is that little contraption there supposed to do?
So this machine is called a Neopath, and it's really kind of cool. In the movies, a lot of times you still see the traditional mask with the bulb that you squeeze. Well, this machine offers respiratory support by using, caught up there, this little mask. And instead of squeezing a ball, you simply just put your finger over this hole here. And each time I would do this, it would offer a breath of air for the baby.
Oh, that is slick.
Yeah.
Oh,
Very
wow.
nice.
That is nice. Okay. All right. Baby breath. All right. Good. I think, so this was a pretty quick tour of the nursery because there's not babies to see, which we wouldn't do for HIPAA purposes either, but nonetheless, this is our nursery.
And we now store our cribs in the nursery because of COVID, and we only have 3 cribs left, so that tells you something.
Oh yeah, the floor is kind of busy today. So all right, let's walk to another spot that I think some folks would be interested in seeing. Hey Annette, where do you think we should go to next?
I think maybe we should try out the whirlpool room.
Ooh, whirlpools.
Yes.
Yeah,
Give our
yeah.
patients some comfort and take the pains away for a while.
Okay. I think that sounds like a good plan. Off to the whirlpool we go. All right, Annette, tell me what's going on here. What do we do for the women who have delivered babies?
Well, in here we offer them the whirlpool to relax and relieve their pain, if they would like to come in here for a couple of spurts of, just to get away and relax. It helps relieve that back pain, the discomfort of those contractions sometimes in the um, up in the abdomen, and it just relieves that discomfort.
This looks a little different than your typical whirlpool in that the big jets you don't see. You have more of these little bit. I don't know if Liz's camera's picking that up, but there's these little bitty perforations. What's going on with that in that?
That just gives them the bubble effect, and doesn't really do anything for discomfort or anything, or bubbles.
It's for bubbly. Okay. All right.
Sometimes visit the whirlpool room after delivery too, if they have had a tear and want a little bit of warmth after 24 hours. They'll come in here and just kind of relax for 10, 15 minutes to kind of take away some of that discomfort as well. Sure.
So I guess I was understanding that I thought it was for after delivery. This is also if you're in the process of you're in labor, it gives you a little bit of. I did not know that.
But we do not do water.
I was gonna say you don't do the you don't do the Madonna thing. And,
No.
All right, just checking. That may have, a lot of stir may have come up out of all this. So all right, so no, we don't do deliveries. Okay, we don't, but you can't control deliveries all the time.
We are prepared.
Have we ever done a delivery in the tub?
Knock on wood. Not yet, but we are prepared. We have all our instruments ready in case we do.
Okay, all right. So all right.
Yeah.
Very good. Okay, let's go somewhere else. How about a room?
Okay.
Where we would have labor and delivery. And I think you're gonna. What's the deal with this room that you're taking us to, Vanessa?
So we have a designated room for our COVID positive patients, or those that we're expecting to maybe come up as positive once we have the results back. So this room here is where we would put those moms for their delivery, and that's where they would stay throughout the duration of their stay.
Okay, well, let's take a look. Come on in. Go ahead, Vanessa. Go ahead, Annette. Annette, I forgot to ask you, Annette. You have some title that you do here too. I failed to ask you. What is your role?
Well, right now I just changed over to the OB educator, quality improvement coordinator.
Okay.
But I also was doing the follow-up visits. So when moms and babies come back, we check them over, make sure everything's going great for them, and help them with any needs that they need.
Sure. Do you still do that, or is someone else doing that now?
Well, Marcella is going to be taking over with that, and a couple of the other gals, Amy and
so you're
Heather.
transitioning out of that role and doing more of the education stuff. Okay.
Which I'm going to miss that a little bit.
Yeah. I would get calls from you every once in a while about, hey, here's taking a look at a baby, and what do you think about this or that? So
exactly.
Yeah. So ladies, tell our folks that are watching some things that is typical about this room, and the things that are a little different because of how you have it set up for COVID.
Okay.
You want to take that on, Annette?
Well, we have everything set up in here so that we can hopefully keep everybody together in this room at all times. Specifically, when baby is born, we'll take the baby over and check the baby out. And as long as everything's fine, we keep them all together in here, as well as dad or whoever's with mom.
Yeah. So in terms of like the bed itself, it's a labor bed. So my hunch is that this bed can be like a bed, but then it can break down when it's time to go ahead and have your delivery.
Definitely. Yep.
Okay. All right. So this bed, we won't do it, but it breaks down to be able to accommodate that. Now, obviously, we don't do C-sections in these rooms. So if someone is not progressing and or something's going wrong with the baby, or you have some concerns, then they would go down the hallway for their C-sections.
Correct.
Okay.
And then we just prepare all of ourselves with the correct PPE.
Yeah. Okay.
We've actually drilled that scenario too. If you have a COVID positive patient who needs to go to the OR, how do we navigate that to get them back there safely while not contaminating the unit?
Yeah.
So we've been through drills to help prepare us for that, because it did happen in real life.
Okay. All right. That's why we drill. This looks a little more than I would normally see in a labor and delivery room. So tell us a little bit about that, Vanessa.
Yeah. So this is an isolette. We don't typically have these in labor and delivery rooms, but This just offers a physical barrier for the baby. So if the mom is actively coughing and symptomatic, then the AAP, the American Academy of Pediatrics, they request that the baby is put into an isolate so that you have that physical barrier to kind of help protect the baby from spreading that infection.
Okay, so like if a mom is COVID positive, then the baby's in the room still, but they're in this isolate.
Correct.
How about if the mom is breastfeeding? What do we do then in that?
We encourage them to keep their hands clean.
Okay.
We have sanitizer close to them as well. We encourage them to mask.
Okay. So they're still breastfeeding though, even if they're COVID positive.
Yes.
Okay. All right. Yeah, and you guys have these folks for a C-section at the maybe nowadays 2 or 3 days, but so it'd be hard to tell if babies are getting COVID from moms. Do we have any sense of that?
We do testing on the babies as well at 24 hours and 48 hours is
Yeah.
what they recommend.
Yeah, but that wouldn't necessarily pick anything up because most infections take a little while to.
Correct.
Yeah. Okay. I'm just curious.
Most of the
Yeah.
transmission is horizontal.
Okay. I haven't read a whole lot about babies getting COVID from moms, but I be honest with you, I haven't done a lot of research on that. So, okay. Anything else about this room that I saw when Annette opened up that door there? What's all that for, Annette?
Well, we have certain restrictions that, with any of the COVID patients that we don't want to run any oxygen for anything that's going on, just in case
Okay.
of transfer.
Okay. All right.
So we just want to be very careful.
So how do we do it differently then with a COVID situation?
If they
needed oxygen.
If we needed to, we would go over here and be farther away.
Okay.
From,
okay. All right. Got it. And then this is, if you didn't have this sign up though, this would be what you'd have for
a regular delivery.
Yeah. So
yes.
If mom
for
needed
mom,
some oxygen
and suction.
Okay. All right.
All
So
that
yeah,
good
when
stuff.
you're going through the process of everything. So
Yeah.
Okay. All right. Well, good. Anything else that I would want to add about this room here,
No,
Vanessa?
otherwise it's a typical.
There's
delivery
bathroom
room. It
through
looks
there.
Just,
Yeah.
looks just like any other delivery room except for extra piece of equipment, and then we go ahead and leave these devices in here throughout their stay. And
Okay.
once the mom goes home, then it's all cleaned together.
Sure.
In a special way.
Okay, good. Hey, I think you were telling me there, speaking to what you are transitioning out of, Annette, that room where moms or whoever goes with the baby after they've been delivered, they've been discharged and they come back. Can we walk down the hallway and take a look at that? Okay.
Definitely.
All right. So this is kind of your kingdom that you had for a number of years. I know you'll be able to give us a good tour. So how many rooms do we have here?
We have 10 rooms.
Okay. All right. Sounds like we have a decent number of them being used right now.
We do.
That's good. That's good.
Typically, when moms and babies come back, we have them come back in here. We have them just sit down, relax, take it easy.
What's the time frame that mom and dad usually come back with the baby?
It's usually 1 to 2 days after they've gone home.
Okay.
And then we just make sure mom's doing okay with either breast or bottle feeding.
Okay.
And then we check over for jaundice, make sure that level's okay. If we need to do any interventions there, we'll do that. Make sure mom's blood pressure is okay.
Okay.
And just
So
answer.
it's mom and baby when they
Definitely.
come back. Okay.
Yeah, even dad, he's
Yeah.
in the picture too. So
Really? Okay.
we don't,
yeah.
we don't want to take away from them too,
Sure.
So, or,
'Cause I always
any
heard from you more
significant other.
I always heard from you more on the baby side because I'm not an
Yeah.
obstetrician, but okay. So the moms get a check over, baby gets a check over.
And any concerns that they have, any questions that they
Yeah.
have, we try to answer those or point them in the right direction.
Yeah, it's a great service because I there's even if it's not your first child, every
There's
child
lots
can
of
be a little
questions.
different.
Yeah.
How
They're
long
all different.
how long does your typical visit take if you're doing something like
Usually
this?
about half an hour, I would say.
Okay.
Yeah.
All right. Okay. Yeah, that's a solid amount of time.
Yeah.
So
Yeah. They come in here crying sometimes and they leave here smiling, and that's what makes it all worth it.
Oh, that is awesome. Yeah.
Yes.
Okay. What were you gonna say, Vanessa?
There's one other place.
Oh.
You mentioned baby friendly.
Yeah.
And so this room was added
Let's
in
do it.
the last year and a half, I would say.
Okay. Well, we should see it.
And this is a special perk for our employees.
Ah, okay.
So
Come on, go on in there,
we
Liz.
created this pumping room for our breastfeeding moms who are expressing breast milk at work.
Okay.
So they can come in here and pump, and then we install the sink so that they can wash their parts and just kind of
Nice.
relax and
Nice.
have a little privacy.
This used to be like the call room, didn't it?
Yeah.
So the doctors know they're not sleeping
Included the
anymore.
doctors.
Yeah. All right. Okay, good.
They have a new call room.
Oh, okay. Well, we'll leave the call room alone. But I remember this being this little kind of small
Yeah.
place for them. So good.
This is nice.
Yeah, it is. That's a great idea. Great idea. Okay, well, ladies, thank you so much. It's been nice to take a little tour with you all and see what the floor is like. And
Thanks for joining us.
yeah. And then thank you in advance for our conversation today, Vanessa.
Sure. Of course.
All right. Thanks everybody for tuning in. Take care. Bye.